If you've been experiencing a nagging pain on the outside of your hip, especially when lying on your side, walking or climbing stairs, then this video is for you. Today I'm talking about Greater Trochanteric Pain Syndrome, or GTPS for short, which is also known as Trochanteric Bursitis or just lateral hip pain. It's a very common problem, especially in people over 40, and it can really interfere with daily life. So I'm going to go over what it is, the symptoms to look out for, how it's diagnosed, what causes it, and most importantly, how you can manage and treat it yourself at home. We'll also cover the established medical treatments and also some of the newer emerging treatments. I'm Stephen Bunting and I'm a specialist MSK physiotherapist working in the UK. Welcome to my channel where we discuss the common MSK problems that affect everyday people and the evidence-based treatments that can help. GTPS used to be thought of as trochanteric bursitis, but we now know that tendon issues are the main problem in the vast majority of cases, not the bursa. We know this from imaging studies, and in fact I must have ultrasound scanned hundreds of patients with this condition over the last 10 years, and I've only seen a true bursitis in 2 patients. What I see in the vast majority of people with the condition are degenerative changes of the gluteal tendons, especially the gluteus medius and the gluteus minimus tendons, which attach onto that bony region on the outside of the hip where all the tenderness is. Think of tendons like ropes that connect muscle to bone, and these gluteal tendons and their muscles play an important role in stabilizing the hip when standing on that leg. And if you overload these tendons repeatedly, small frays develop, kind of like worn out rope that's been pulled too hard and too often. So GTPS is essentially a degenerative condition of those gluteal tendons. GTPS causes pain on the outside of the hip, right over that bony bump known as the greater trochanter. Common symptoms include a deep, aching pain on the outside of your hip, pain when lying on the affected side, especially at night, pain when walking, climbing stairs, or standing up after sitting for a while, and tenderness when pressing on the outside of the hip. Occasionally, pain can radiate down the side of the thigh, but it usually doesn't go past the knee. Now, sometimes symptoms will start after a fall or a direct injury to the outside of the hip, but most commonly the symptoms creep up over time. GTPS is diagnosed based on having the symptoms of lateral hip pain that we discussed earlier, and particularly that tenderness directly over the greater trochanter. Imaging can also be helpful, but it's not strictly necessary to make the diagnosis. But an MRI or an ultrasound can assess the quality of the gluteal tendons. They can look for tendon tears and check if there's any fluid in the bursa, although, as I mentioned earlier, true bursitis is very rare. It's also important to know that GTPS is often misdiagnosed as hip arthritis or sciatica because the pain patterns can overlap. But unlike hip arthritis, GTPS is felt more on the outside of the hip, whereas hip arthritis is more often felt deep inside the joint, particularly in the groin area and sometimes deep in the buttock area. Sciatica will often involve some lower back pain and can often radiate below the knee and into the foot. It's also commonly associated with pins and needles or numbness in the leg or foot. GTPS is essentially an overuse condition. It occurs when we overload those gluteal tendons, meaning we're asking them to do more work than they can handle at the time. So it can occur in active or sporty people who push their activities too aggressively or too repetitively, usually running, walking or other weight-bearing sports. But these are the minority of people with GTPS. In most cases, it's caused due to a general weakness of the gluteal muscles to the degree where the tendons become easily overloaded and symptoms occur. And the main cause of gluteal muscle weakness is spending too much time in sitting. It's also a much more common problem in women due to the wider female pelvis, which puts more pressure on the gluteal tendons, and also the effect of female hormones on the muscles and tendons, especially during and after the menopause. One of the other main causes of GTPS is being overweight, because this puts significant strain and overloading on the gluteal tendons and is in fact one of the main risk factors for developing the condition. So if I had to describe the typical patient that I see with GTPS, it would be a 55-year-old woman with a desk-based job, or perhaps who works from home and has become fairly sedentary over the years. Often not because she's done anything wrong, but because life has just steered her that way. Because of this, she may have gained a bit of weight and her general fitness might have reduced as a result. She then does a 10k charity walk one weekend, which is much further than she's walked in a long time. And suddenly the pain starts. And that's the typical story that I hear. And indeed, that's the classical recipe for developing GTPS. You essentially have to suddenly ask your gluteal muscles and tendons to do more activity than they can handle. Okay, so let's move on to what really matters: how to treat GTPS. And the good news is that most people will get better without surgery or injections, just with the right self-help and some targeted rehab. Which is great, because this is where you can take real control. In fact, self-help treatments are usually very effective, but only if you understand the basic concepts and you do them properly and consistently. So let's explore this a bit further. To get GTPS better, you have to essentially do two things. Firstly, you have to give those poor tendons a rest by reducing your daily standing and walking. Now, I don't mean complete rest, I just mean a general reduction in activity until symptoms start to improve. Ideally, the pain needs to settle to about 5 out of 10 on a pain scale, or less. Now, this might take a few weeks or a few months, or it might be at that level now, in which case you can then start the second part of the recovery process, which is to slowly strengthen those gluteal muscles and tendons. And this time you do it in baby steps, not with sudden bursts of activity, because you don't want to flare the condition up again and go straight back to square one. Okay, so let's go back to the first part and start with some simple things that you can do immediately to help reduce that pain to below the 5 out of 10 threshold. Number 1, avoid sitting with your legs crossed. This compresses the irritated tendon against the bony greater trochanter. Tendons hate being squashed, and so this is a quick win. Number 2, avoid sleeping on the painful side if you can. This is another thing that squashes the irritated tendon. Number 3, try to sleep with a pillow between your knees. You're trying to stop one leg from falling across the other and compressing the tendon again. You can buy a contoured knee pillow, which can help keep both legs in the same mirrored position. Number 4, temporarily reduce long walks or uphill climbs until symptoms start to improve. So this is an attempt to rest the irritated tendon. Number 5, use heat and ice. An ice pack over the painful outer hip region for 20 minutes at the end of each day can help reduce any pain or inflammation. And then applying heat to the gluteal muscles in the buttock area can help reduce muscle pain and tension, especially after exercise. Number 6, try to avoid limping when you walk. This just encourages bad habits and causes further muscle weakness. If you find that you are limping due to pain with every step, then use a walking stick, a cane, or even an elbow crutch if needed. Try to concentrate on keeping your pelvis level when walking. So once the pain has started to settle, then you should then start some targeted exercises to help increase the gluteal muscle strength. And the evidence clearly shows us that this is the single most important thing that you can do to get the problem properly better, as long as you do them consistently, gradually and safely. In fact, the research suggests that 90% of GTPS cases will respond to gluteal exercise programs. So now I'm going to go through a suitable program with you. Just start gently and slowly progress as pain allows. This is going to take a few months, so don't be in a hurry. As a guide, when exercising, try and keep any pain below about 5 out of 10 on a pain scale like this. So the first basic exercise to try is the clamshell. Lie on your side, painful side uppermost. Keep your pelvis stable and your knees and ankles stacked on top of each other. Then, keeping your ankles together, slowly lift your top knee off your bottom knee as far as you can without your pelvis rolling backwards. Do the exercise slowly and deliberately, holding the end position for about 3 seconds and repeating 15 to 20 times. You can swap sides, but only if you can lie on your affected side without pain. If you can do this easily, then it's time to progress by using some resistance band. Again, aim for about 15 to 20 reps, but you can adjust this according to your abilities. To make the exercise a bit harder, go up onto your elbow like this. This encourages more core pelvis muscle activity. You can also use the resistance band in this position. The second basic exercise is resisted hip abduction in standing. So stand about a foot from the wall, then take your affected leg out to the side and push it into the wall with your ankle. Only push as hard as feels comfortable to you. Hold the exercise for about 5 seconds and repeat about 10 times. You can increase the hold time and number of repetitions as you get stronger. The third basic exercise is the side plank. So the idea here is to lie on your side and then support yourself on your elbow while keeping your lower body in a straight line right down to your ankles. So the only point of contact with the floor should be your lower forearm and elbow and your lower ankle. Hold for about 15 seconds and then swap sides. Progress by holding the positions for a longer time. Aim for 30 seconds and repeat 2 or 3 times for each side. If you can't manage this, which might be the case if you have shoulder or elbow problems, then don't worry. Just leave this one out and concentrate on the others. The next 3 exercises aim to progress your gluteal muscle strength functionally. So these exercises are designed to mimic some of the basic movements you need to be able to do in everyday life. The first of these is the bridge. Start by lying on your back with knees bent to 90 degrees. Then slowly lift your pelvis off the floor as high as you can comfortably. Hold for about 5 seconds and then repeat 15 to 20 times. If this is too easy, then try doing a slow stepping motion like this. Aim to keep your pelvis nice and level throughout the movement. And to progress further, you can do the same exercises but with some resistance band around your knees, like this. So you're trying to apply some tension to the band by keeping your knees apart throughout the exercise. The second functional exercise is the squat. This is one of the most important exercises for GTPS. In its most basic form, you are just doing a small squat like this. Keep your back straight and your feet flat on the floor. Don't go up on your toes in the lower position. Go as low as you can without pain. You can use the back of a chair or a wall for support if needed. Start with 2 sets of 10, but progress to 2 or even 3 sets of 20 if you can. To progress further, You can use some resistance band around your knees and keep the tension on throughout the exercise. The last functional exercise is standing hip abduction with the resistance band. The key here is to find the right amount of tension so that you can do the exercise without swaying or losing your form, and you can repeat it about 10 to 15 times. You can then swap legs and repeat 2 or 3 times for each side. The final 3 exercises are the dynamic movements, and the first of these is sidestepping with the resistance band around your knees. This works the target muscles really hard, and so you will feel the activity in your glutes. About 3 lots of 30 seconds is a good start. The next one is a stepping exercise. You can do these using the bottom stair if you don't have a step like this. Start by simply stepping up and down. Lead with one leg, for example right foot up, right foot down. Repeat 15 to 20 times and then swap legs. Progress by taking larger steps and then involving your arms like this. The second part of this exercise is the side step. So turn sideways on your stair and then step outwards and downwards like this. Again, do the exercise in a slow and controlled way. Don't step down heavily. The final dynamic exercise is another really important one, and indeed, if I had to choose just 2 exercises for most people with GTPS, it would be the squat and this balance exercise. Start by just trying to balance on one leg. It's best to do this in bare feet if you can. You can see that I'm using my hand against the wall to support me when I need to. Eventually you should be able to manage without using the wall. Aim for 20 or 30 seconds at a time. When you can do this easily, it's time to progress. While balancing on your affected leg, try to lean slowly forwards and then return to your start position. Go as far as you can, even touching the floor if you can manage.
Okay, so that's the standard exercise program for GTPS. Try to do the exercises for about 15 to 20 minutes daily and then slowly increase your walking distance as your pain starts to improve. And remember, exercises don't work instantly. It takes time and effort to get your muscles stronger, so don't expect any quick and easy results. If you do see people online peddling instant cures for GTPS, then steer clear. It's just clickbait or they're trying to scam you. So to summarise this section, I mentioned earlier that the cause of GTPS is overloading your gluteal tendons beyond their capabilities. So the whole idea of this rehab program is to steadily increase the capabilities of your gluteal tendons to the degree that they can now cope with the amount of standing, walking or running that you want to do. It's as simple as that. Now before we move on to the next section, I do need to stress the importance of weight loss if appropriate to you. We know that even a small reduction in body weight can significantly reduce the strain on the gluteal tendons. And indeed, the main reason I see for patients with GTPS not getting better is a failure to understand the importance of being a healthy weight and acting on it. And the last bit of self-help advice to consider is what to do in the future to make sure this doesn't become a long-term problem. We know that the main cause of GTPS in the majority of people is gluteal muscle weakness caused by too much sitting at work. So the first thing I would advise to do is to get a riser desk and start to slowly increase the amount of time that you spend stood up at work. This can be something simple like this converter, which I use on my desk. It costs about £60 or $80 and it just goes on top of the desk and you can quickly lift up the monitor, keyboard and mouse to a standing height. So this is a cheap and easy addition to your workspace. Of course, you can get proper riser desks like this one, which are going to be better overall in the long term, so do speak to your boss and see what can be done. And if you are the boss, then this is a great investment in the health of your staff. Studies have shown a clear reduction in sickness absence from musculoskeletal aches and pains in people who use riser desks. There are lots of healthcare benefits to be gained from standing at work more often, including weight loss, improvements in cardiovascular health, and increased leg muscle strength, as well as being generally more alert and more productive. I've done a separate video all about this topic, and you can check that out up here. And I'll also put a link to the riser desk converter that I use in the video description. So if you've tried the self-help treatments that we've discussed and they haven't worked for you after about 3 to 6 months, then you're in the unlucky 10% of people with the condition, and other options might now be considered by a healthcare professional. The first of these is usually a corticosteroid injection. These can reduce pain in the short term, and its main value is where pain isn't improving and is preventing someone from doing the exercises. But they aren't usually a cure, and indeed they may weaken the tendons over time, particularly if they're repeated. In my practice, I offer one injection for severe cases, with the intention of reducing the pain so that sleep is improved and so that the exercises can be better tolerated. If it doesn't work, or if the effect wears off quickly, I usually won't repeat it. Shockwave therapy is another option. It's a treatment that uses high-intensity sound waves to try and stimulate the healing process. Some people find this helpful after conservative treatments have plateaued. It can be a bit uncomfortable, so it's not going to be suitable for people with very severe hip tenderness. It usually involves a course of 3 20-minute treatment sessions given weekly, and it can be repeated over another 3 weeks if needed. Another treatment gaining popularity is needle fenestration. So this involves using a normal hypodermic needle, almost like a mini scalpel, to cause some bleeding of the gluteal tendons. Blood contains growth and repair factors, and so the idea is to try and stimulate the body's normal healing process and focus it on the degenerative tendons. The procedure is done under ultrasound image control after the area has been anaesthetised. And another type of injection takes this idea a step further. Platelet-rich plasma, or PRP injections, involve taking some of your own blood, spinning it in a centrifuge, and then when all the different layers separate out, you take the layer with all the platelets because they contain a high concentration of those growth and repair factors. This platelet-rich plasma is then injected under ultrasound guidance into the gluteal tendons, again with the intention of trying to stimulate the tendons to go through that healing and repair process. For people who might have had GTPS for a long time and it hasn't responded to all the treatments that we've discussed so far, then some pain clinics offer a pain relieving treatment called radiofrequency ablation. This involves using a specialised needle which can heat up to a high temperature to essentially burn away the small sensory nerves that carry the pain signals from the tendon to the brain. It's a fairly new treatment for GTPS, and there haven't been any large clinical trials looking at it just yet. This small study in 2022 describes good results from 8 cases, and I'll put a link to it in the description if you want to read it. The nerve will usually grow back at some point, and so this isn't usually a permanent cure, but effective pain relief for a few months or a year or more has been described, and it can be repeated if needed. And the final treatment to discuss is surgery. And it has to be said though that surgery is by no means a routine procedure for GTPS or a guaranteed cure. Indeed, most hip surgeons that I speak to will not treat GTPS surgically, either because they don't think it's an effective treatment or because they aren't convinced by the evidence. But some surgeons do offer a keyhole procedure which involves removing the bursa, releasing a tissue called the iliotibial band which sits over the gluteal tendons and is thought by some people to contribute to the condition, and then also a tendon micropuncture procedure that's similar to the needle fenestration that I mentioned earlier. Again, I'll put links to a review paper which has looked at the surgical results,
But like I said earlier, it's early days and only a minority of surgeons are offering this at the moment. Okay, so those are the interventional treatments currently being used, which are supported by some clinical research. They certainly aren't a guaranteed cure, and their effectiveness will be lessened if you have a very degenerative tendon or if you're very overweight or diabetic. So their use has to be carefully considered because with all interventional treatments, they do have the potential to make things worse. So to wrap up, greater trochanteric pain syndrome is a common and often frustrating condition, but the good news is that it's very treatable. So don't lose hope, stick with the plan, give it time, and your hip will thank you. With the right approach, a bit of patience and persistence, most people get back to walking, sleeping, and living without that nagging pain on the outside of the hip. If you found this video helpful, then please give it a like and consider leaving a comment. It really helps others to discover the video and the channel. Well, that's about it for this one. So thanks very much for watching. Take care and bye for now.